I am Dr. Alfred Marquez. I have a very special guest with me today, Araceli Trevino. Araceli Trevino is at the El Paso Center for Diabetes. We're going to go through a lot of different things. Her training was at New Mexico State, Aggies. Don't hold it against her.
Don't hold it against me.
But she's very well versed in nutrition, very well versed in as a dietitian. She did her internship in Iowa State,
That's correct.
and she's been with the El Paso Center for Diabetes now for 4 years, correct?
Correct.
Okay, so uh, this is exciting for me. So what do you say? Shall we talk diabetes?
Let's do it.
Let's
Let's
do
talk
it.
diabetes.
Let's talk diabetes. So I'm going to point this out. My statistics might be a little bit different than yours,
Okay.
but what I saw is in the whole US of A, 50% of adults are either pre-diabetic or have type 2 diabetes. And I think that's a big concern because this number 50 years ago was only 1%.
Right. So
That's
there has been
incredible increase.
Yeah.
To me, what is super scary are teens. 30% of teens today are pre-diabetic, and that was something that 30 years ago was unheard of.
That is so true. So yeah, so I agree with the numbers that you have. That the percentages that I have at the United States, it's a 15% of type 2 diabetes.
Type 2.
Of type 2 diabetes. And so in El Paso, because we are a border city, the percentage of people with diabetes here keeps growing year after year after year. And like what you're saying, adolescents, and also what we're seeing is a lot of adolescents, but children
Yes.
with type 2 diabetes. So
Right.
we have been seeing an increase with these young kids, even at the age of 5, that are getting diagnosed with not even pre-diabetes, but type 2 diabetes. And also, there's a lot of people that are just out there that are not even diagnosed. They're
Right.
walking around
Yeah.
not knowing that they have this disease, which is very sad. So these numbers may be even higher if they were to be taken a test and be diagnosed with diabetes.
So we here in El Paso, Texas, are #1 in the whole US of A. Is that correct?
That is correct.
It's not a good #1 to be at.
It's not a good
Yeah.
number.
No.
Yeah. No.
Yeah, we're #1. That's
We're
that's
number
really
one.
sad.
Yeah.
But hopefully we change that. My goal of this interaction that we're going to have is to simplify diabetes, help patients understand what diabetes is, because I feel that if you do, you're not going to be afraid of it and you'll know what to do. Because so many people say, oh my God, I have diabetes, and it's like a death sentence. It's not a death sentence, correct?
Yeah, and I agree with you. At the moment of diagnoses, patients are fearful. They're
Yeah.
scared. They're alarmed.
Yeah.
And it all goes back to not having that proper education or really not knowing much about the disease. And so it's very hard to manage this if you go into it with this fear.
Right.
And really not knowing much about it, but they feel like, okay, I've been diagnosed with
Yeah.
diabetes, and
Yeah.
so what's next?
Right.
It's a death sentence. I'm done. My
No.
life is pretty much it's over.
It's over.
It's over.
But it's
and,
not true.
And I hear that, and it's not true.
Yes.
Diabetes is a condition that it can be managed.
Absolutely.
And it can be done through that proper education.
Right.
And of course, getting the diagnoses within time to do something about it.
So let's differentiate between diabetes, the type 2, the type 1 diabetes. We hear about type 2, we hear about type 1, we hear about people poking themselves with insulin. Let's start off with type 2. Tell us, help us understand what that is.
Okay. So type 2 diabetes, diabetes is a metabolic condition.
Correct.
That it doesn't know how to use sugar as energy.
So in other words, the cells in our body are not responding to the way they should. and
Exactly.
creating the
So,
energy
so
the way
what
they
what
should.
happens with the type 2 is, as a for instance, pretty much the food that we eat gets converted into sugar. Okay, so it
Correct.
goes into our bloodstream, and so the
Right.
sugar sitting in our bloodstream, and it should not stay there because if we have sugar in our bloodstream, well, then we're going to have complications. And so therefore, when the brain senses there's this sugar in our bloodstream, it tells the pancreas, hey, let's get some insulin going.
Right.
So this insulin is this transporter that attaches to these sugar molecules, and it's supposed to transport to these cells. And so with type 2 diabetes, we have what we call insulin resistance. So the pancreas is making insulin, but for whatever reason, it's resistant. It doesn't allow the sugar to get into the
The
cells.
cells don't listen.
They're kind of like they're blocking it. That key is probably not the right key, or we have a little bit of fat around our cells, and so this is resistance. And so then what happens is the brain keeps telling the pancreas, hey, you're not doing your job, let's do more insulin, and so we're overworking the pancreas. And so within time our pancreas just kind of stops kind of producing because we've been overworking it so much.
So I kind of like this comparison that I heard one time. If we're in a room and this room has a stench, you're sitting there and you smell it, and then after a while you stop smelling it. The stench is still there, but you can start smelling it. If they elevate the stench, then again you smell it.
Right.
And that's kind of the way the cells are, is they slow down, they quit responding to the insulin the way that they should, and so subsequently the body's trying to elevate it to control the sugar. So in reality, tell me if I'm right or wrong, the problem isn't so much a problem with sugar, even though yes it is. The problem is with the signaling and the way our cells respond to the insulin. Is that correct?
That is correct.
Okay,
That is correct. So the cells are sensitive, and so then it doesn't allow for this sugar to come in because our cells, our body's composed of so many cells, and these cells need this glucose or this it's energy in order for our bodies to just be active and just be for everyday living. I mean, to think, our skin, we can go to everything pretty much. And so then what happens is we have all this excess sugar in our bloodstream, and so within time we check sugars and our sugars are elevated because
which is a symptom.
so then that's a symptom, and so then that's the type 2. So the type 2, our pancreas is still working, but there's this insulin resistance.
Okay, let's go into type 1. Type 1 is, well, tell me, first of all, I imagine type 2 is much more common.
It's a lot more common. So 90% of cases are going to be type 2 diabetes. So it's a lot more common than type 1. And like we were just talking about education, when I have my patients and I ask, well, do you know what type of diabetes you have? And I don't know. They ask me, I think I have the good one, or maybe I have the bad one. So it's very, right. And I'm thinking, oh my goodness, and how long have you had this disease? And 10 years and they still don't know which type, which is it's managed very differently. So with type 1, what happens with type 1 is the pancreas no longer makes insulin. So it's more of a autoimmune. So what happens is our own immune system attacks our beta cells, which are these helpers that help the pancreas produce the insulin. Right. And so therefore it's a trigger, it's a response to saying, no, these are foreign invaders, let's attack them. Right. And so then no more insulin. Right. And so it's autoimmune, and it's pretty much caused by an environmental factor, could possibly a virus. So much research is still being done as to what could be causing that. So, basically is, do you have an insulin pump, or do you use insulin? And so no, so then you don't have type 1, because sometimes people say, no, I have type 1. Yeah. Okay, are you on insulin? No. Okay, so no, your body's still making insulin. So So then that's the difference between the two diabetes.
The type 2 and the type 1.
Right, right.
So you mentioned something I thought this, it's very interesting. You were talking about our cells, and I don't think we realize it because I didn't realize this, but right now we're sitting here, our bodies are composed of roughly 40 trillion with a T cells. You have 40 trillion, I have 40 trillion, and these cells are constantly multiplying. In fact, in a 24-hour period, it said that we get 30 billion new cells every 24 hours. 30 billion. Okay, so in fact, while you and I are sitting here during this, we're going to leave here with each one of us maybe having 1.5 billion new cells. To me, that's incredible.
Yeah, it is
It's
incredible.
incredible. So it just goes to show how complex our bodies are, how the function of each cell is so critical. On top of that, and we'll get into this a little bit later, is our biome, our bacterial biome. I believe the number I saw was 70 trillion cells, bacteria cells that live in us and on us, that coexist with us, and we need them because otherwise we don't have an immune system. So many different things that this bacteria is tied into. Right. So I think that's super interesting, and hence in looking at this, the cells break down or don't work the way they're supposed to, and then you start developing signs. So what are those signs?
Okay, so what happens is when we eat, and so then we digest the food. 2 hours later, our sugars are high. Our cells are tired because they're not getting this energy. They're not getting this burst of glucose. And so what happens is fatigue. So some of the signs is fatigue, and then you're tired, and then you're thirsty. So then the thirst, it's extreme thirst. And so then you start, more frequent urination. So that's another sign. I find myself going to the restroom a lot more at night. And so now we have interrupted sleep. Our sleep is not of quality because we're getting up many times throughout the night. We start to experience some blurry vision. I use glasses, but now I feel it's very hard for me to see. And so we have that as well. Perhaps even slower wound healing. You know what? I got a cut and it's taking a little longer to heal. And so some of these signs are, these more, you're hungrier. Or what I've seen too is all of a sudden I dropped all this weight, in a matter of 2 months. And so then we want to say, okay, was that intentional? Did you, what happened? And so it was like, no, I kept eating the same, but I've been just tired, I've been hungrier. And so then what happens is all the sugar is sitting in our bloodstream. And so now our body is using fat as a main source of energy. And so then that's why we have the huge drop in weight immediately. And we're talking fast. We're talking person is like, okay, my pants are falling off. And the fatigue is just extreme. And so these are the symptoms. And so it's a cycle. It's a cycle where, the kidneys, you're going to the restroom, but then of course sugar is a macronutrient that our body needs. So then we have we have a molecule in our nephrons and our kidneys that will put the sugar back in. So sugars are high, thirst is high, frequent urination. So it's just a vicious cycle. And so then you're kind of like, okay, you got to, go get yourself checked.